Hi, Lisa.
Hi, Dr. Weed.
How are you?
Good, thanks.
I hear you got some pain between your shoulder
I
blades.
do. Stiff.
You've treated your neck and shoulder, but
Mhm.
there's a spot between the shoulder blades
Yep.
you can't quite reach, right?
Yep.
So that's when you need a laser buddy.
Yes, I
All right,
do.
well, I'll be glad to be your laser buddy. So I'm going to work on your back, and you'll tell me if I'm in the right spot. And I'll set it on very, very low, and start on top with what I call a little painting technique to just spread the conductive gel, and at the same time already stimulating all the tissues. Oh boy, you got some good sized knots here. You've been working out again?
Yes.
Yeah?
Yeah.
What do you call that exercise you're doing?
Oh,
Which one? Oh, there's something times something?
oh, the hundreds?
Hundreds times what?
Well, it starts with 2 by 50,
2 by 50.
3 by 60.
3 by 60.
Today
Okay.
was 2 by 75.
Holy smoke, I got tired listening to it. Now, I'm kind of working right in this area here, and these muscles here called the rhomboids. So when you're lifting your arms, these muscles have to work, and so that's why I'm feeling all these knots. Now, can you gently turn your head side to side, and oh good, do you feel anything when you do that?
Yeah, I feel it.
Right here. So I'm going to have you push up against my hand. That's right, good. Oh boy, that's a good spot there, isn't it?
Mm-hmm.
It really is. So, okay. Now, tell me how that feels now. Bit looser?
Yeah, it feels better.
No, it's amazing how red this whole area got. And you've got some stuff up here too?
Mm-hmm. You released the other side, I felt the other one.
Okay. So it's interesting, isn't it? You released one side, and then all of a sudden the other side starts talking back to you. And that's probably because it was there all along. Your brain just wasn't paying attention to it. Yeah, you got a good spot here, so gently push again. And I'm using a fair bit of pressure here, trying to do some soft tissue release work as well, because this instrument was designed to do that also, and simultaneously treating. And by the way, I'm still within that 2-minute time period that this device stays on. Just went off, so I just switched it on again. And you got another spot here, so look down to your right and push up again. Good, good. Wow, that's getting pretty red too here.
Feels better.
Mm-hmm. So you can really, when I point at this chart, you can really see the layers. That's your trapezius muscle. It goes all the way up to the back of your neck up here, and the base of your skull, and it goes all the way like a wedge all the way down to about your brow line here. And then underneath the rhomboids that are on this side and this side, and then there's long muscles that go up and down. Now try that again. How's that feel? Pretty good?
Feels a lot better.
You know, and while we at it, I might as well work on your lower back too, because I notice that you're kind of guarding that. So this is good. You lean over forward, and I'll start doing some working on the long muscles first, and then we go to what we call the quadratus muscles. And you got a knot here too.
I'm a mess.
Well, it's that something by something you're doing. Now, are you doing weights with that, or?
Yeah,
Give me an example of what kind of weights you use.
just 10 pounds. But
10 pounds, and you do 50 reps or 60 reps on that?
yeah,
What other exercises do you do?
jump squats. And
Jump squats?
walking.
With weights or without
No,
weights?
No weights.
Just
jump
body
squats.
weight?
Yeah.
Yeah. Boy, that got pretty red too there. Now when you stretch, do you feel like it's releasing at all?
Yeah.
All right, okay, let's do some quadratus muscle stretches here. That's good, that's very, very good. Boy, you got some tight little bands here.
Yeah.
All right. All right. Now let's do the other side too, so it doesn't get jealous. Wow, that's good release. All right, good release. Now, I want you to just rotate side to side. I'm holding this stool still. Great. Do you feel any spots that still talk back?
Not really.
No? Fantastic.
Not really. It's
All
a
right.
lot better.
Good. How about chin down on your chest? Anything pulling up or down the spine at all?
A little bit from here.
one up here still. So that's often what happens. You treat the area and then go to another area, and then you find that the original area still has some spots, and you just go back to it. And this way you, you know, pretty much cover all the areas that you need to cover.